A series of events called the menstrual cycle happens about once every month to prepare a woman's body for pregnancy. Changing levels of natural chemicals in the bloodstream called the hormones control these events. The reproductive organs affected by these hormones include the vagina, cervix, uterus, fallopian tubes, and the ovaries. The ovaries produce two main hormones called estrogen and progesterone. As the levels of estrogen begin to rise, it causes the normally thick mucus inside the cervix to thin out. Estrogen also triggers other hormones to cause one of the ovaries to release an ovum. This process is called ovulation. If a woman has sex during this time, a man's reproductive cells called sperm can pass through the thinner mucus to fertilize an ovum. In the uterus, estrogen causes the lining to thicken, which prepares it to receive a fertilized ovum. Rising progesterone levels cause glands in the lining to release fluids that feed the fertilized ovum. Progesterone also causes the thin out mucus in the cervix to become thick again, which prevents sperm from passing through. If an ovum hasn't been fertilized, the levels of both estrogen and progesterone begin to fall. This drop in hormone levels causes menstruation, a process where the uterus sheds its inner tissue lining and blood through the vagina. Birth control pills are medication a woman takes every day to prevent pregnancy. The most common and effective type of birth control pill is a combination pill. It contains both estrogen and progesterone, which is a man-made hormone similar to progesterone. The estrogen and progesterone from the pill maintain constant levels of these hormones in the body. These levels prevent the body from releasing similar hormones that cause ovulation. Without ovulation, there is no ovum available for fertilization, so a woman can't get pregnant. Progesterone also prevents pregnancy by keeping the mucus in the cervix thick enough so sperm can't get through it. A third effect of progesterone on pregnancy involves its influence on the lining of the uterus. In contrast to natural progesterone, progesterone is slightly different chemically. Over time, it makes uterine lining thinner instead of thicker. As a result, if fertilization of an ovum does take place, the lining may be too thin for it to stay in the uterus, so it passes out of the body with the next menstrual period.